The big thing to know is that every surgeon has outcomes that are not what they would want sometimes. It doesn't really matter how good they are, how well trained they are. There are just certain things that you can't control once the surgery's done, and so everybody's going to experience those. So it doesn't necessarily mean your surgeon did something wrong. And patients are writing into RealSelf a lot asking about what should I do? And a lot of times the answer is talk to your own surgeon. Your own surgeon is the one who knows best exactly what was done, all the details of the surgery, and they're going to be very motivated to want to take care of it for you. If you immediately go to somebody else, then you've started a brand new doctor-patient relationship, and you're potentially looking at a lot of additional expense. The other things to know are that the biggest predictor of a revision surgery is a failed revision surgery. So it's really important to get it right the first time. There's a great temptation to maybe try simple things and hope they work, but each operation is going to cause additional scarring, and that makes the subsequent attempts at correction more difficult. So you really have to have a good plan to get it right the first time. Make sure that the surgeons explain to you what they think the problem is and what they're going to do and what they're going to do differently than what was done before. So if plan A didn't work, you don't make plan B the same as plan A and hope for a different outcome. So that's important. The other thing is, if you do decide that you need to go to a different surgeon to correct your problem, they can't really know everything about what was done, no matter how good the records are. But you really want to make sure that somebody who has sort of a special interest in doing that, somebody who sees a lot of revision cases. Because it takes a certain kind of approach to it in your practice. These patients have already spent money, they've already been through surgery, they're unhappy, and you have to really be willing to kind of work with all those things and work with them to formulate a plan that's hopefully going to get a different outcome than they've experienced before.